patients that we take care of, they are often left with no choices. It's either lung transplantation or it's death. The day they get the call for their lung transplant, this is what patients are waiting for. The moment that they get their offer and the moment that I get to tell them that today is your day, this is what you've done all of this for, you're gonna get your new start to your new life, you should see the overwhelm that they have on their face. To do that over and over is such a privilege and such a blessing.
UCSF Lung Transplant Program is the largest on the West Coast, in the top 5 to 6 for volume in the country. But what makes it stand out nationally is 97% survival at 1 year following transplant. So for the last 13 plus years, we are the only program in the country with significantly better than expected outcomes. Our focus primarily has been on increasing access to lung transplant. And we have accomplished that in a couple of different ways. One is by expanding the indications for transplants for our recipients that may have been turned down by other programs, and we have transplanted those patients. But listing is not enough if we don't have the organs to transplant. So the other focus has been on expanding the donor pool. And we have really had major innovation in that regard. We were the early adopters of ex vivo lung perfusion technology, which allowed us to take marginal organs that previously had been declined and rehabilitating them on this device outside the body.
At UCSF, we have a history of taking very complex patients that at one point in time had not necessarily been considered for lung transplantation. And we've had success in these areas really through the collaboration with experts in the field. So for example, when we've really challenged the idea that patients with scleroderma were not transplant candidates, we worked closely with our rheumatologists to develop protocols in order to take care of those patients and get them through transplantation with the same excellent outcomes as those patients without scleroderma. It's the environment of UCSF and the ability to work with these experts in the field that has allowed us to really push the envelope into these complex patient populations and still allowed us to maintain the excellent outcomes that we strive for.
UCSF has an amazing multidisciplinary team that supports both patient survival and support throughout the transplant journey. What we've learned over these last 30 to 40 years of lung transplant is that the complexities that are within the journey to get to organ transplantation is incredibly deep. It's not just something that you can go get an organ and then you're good to go. You need to have deep psychosocial stability, your mental health has to be good, your family support has to be good, and then obviously your body has to be in good shape. In order for us to evaluate a single patient, we need to have so many disciplines that are involved in making sure that all those systems are go. Making sure that the patient is in the most optimal shape for this incredibly scarce resource. With our collaborative team and our multidisciplinary approach, everybody's voice is heard, and if everybody has a chance to say their expertise on the patient's condition and the patient's evaluation, then it's going to absolutely offer the most optimal outcome for the patient before surgery, during surgery, and then ultimately long-term for their survival.
One part of the evaluation process that I particularly enjoy is the brand new patient education. It gives you an opportunity not just to give the patients all the information to get started so that they have that before they come and they meet with our physicians, but it also gives you a chance to connect with the patients one-on-one, and it gives them a chance to know that they have someone on the inside of UCSF who knows about transplant that they can call and they can ask questions.
The systems and support that UCSF puts in place for patients to ensure their success is our comprehensive team approach to care. So we have our physicians, we have our lung transplant coordinators like myself, we have financial coordinators, we have social workers, pharmacists, we have dietitians. All of us come together to make sure we provide that support to the patient so that they have the support that they need.
Evaluation for lung transplant is a series of steps. We have them meet with a physician to help evaluate if this is a good idea to proceed with the process. So there's a medical evaluation, there's a surgical evaluation, there's a lot of evaluation testing. There's a psychosocial evaluation and a financial evaluation as well. And in addition to all that, there's a lot of education that goes on with the patients to make sure that they're not only ready for the surgery, but the recovery and what life would be like after transplant with those modifications.
My job is not just to set up a program where we can provide lung transplantation and get reasonable outcomes. My job is redefining possible, is to really establish an environment where everyone from the physicians to the fellows to the pharmacists to the nurses to the staff are driven, have a mission to improve the outcomes of the patients who are getting lung transplantation. And that's through innovating what they're doing at every level, whether that's in our clinical care delivery, clinical research, or basic research, or even the way we deliver certain therapies. All of those things lead us to redefine what's possible in lung transplantation.
If you look at our team, no matter who it is, we all operate with a shared sense of responsibility and ownership of our patients. That really is the bottom line in our program. We treat every patient like a family.
At UCSF, when patients are transplanted and the nurses start the educational process, the first things we say is, okay, we're family now. For me, my patients are really extended family because I talk to these people day in and day out, and I'm sharing with them some of their fears.
The team that we have built over the time that I've been at UCSF is incredibly powerful, and I know that no matter what the situation is with the patient, I have the backing of the entire team. And so it allows me to come to these patients during their most difficult times and tell them, hey, you've got an entire army that's coming to save you.